Classic Relevant Treatments First Aid Rapid Review. Thanks for joining me, YouTubers. We're going to do an AutoFlashcards review where you test your knowledge and review high-yield information, try to name the treatment before I do, and pause as needed. The benefits of these are we use large and easy to read text with visuals. It's easier than clicking through flashcards and helps you keep that momentum. You can use it with just the video, just the audio, or both video and audio. You can use it on the go, while you cook, clean, rest your eyes, take a walk, whatever you need to get caught up on. And it's fun to compete with a study buddy if you want to do it with more than one person. And these have been carefully reviewed to match the first aid book, though the pictures from other sources have been added. This is just a short sampling of great study tools and concise, high-yield information you'll find in first aid for the USMLE Step 1. Best wishes and happy studying. Number 1, absence seizures. Treat with Ethosuximide. Number 2, acute gout attack. Treat with NSAIDs, colchicine, glucocorticoids. Number 3, acute promyelocytic leukemia, M3. All-trans retinoic acid. Number 4, attention deficit hyperactivity disorder. Methylphenidate, amphetamines, CBT, Atomoxetine, Guanfacine, Clonidine. Number 5, alcoholism. Disulfiram, acamprosate, naltrexone, supportive care. Number 6, alcohol withdrawal. Long-acting benzodiazepines. Number 7, anorexia. Nutrition, psychotherapy, mirtazapine. Eight, arrhythmia in damaged cardiac tissue. Class 1B antiarrhythmic, lidocaine, mexiletine. 9, benign prostatic hyperplasia. Alpha-1 antagonists, 5-alpha reductase inhibitors, PDE5 inhibitors. 10, bipolar disorder. Mood stabilizers, lithium, valproic acid, carbamazepine, and atypical antipsychotics. 11, breast cancer in postmenopausal women. Aromatase inhibitor, anastrozole. 12, Berger disease. Smoking cessation. 13, bulimia nervosa. SSRIs. 14, Candida albicans. For vaginitis, topical azoles. For oral esophageal, nystatin, fluconazole, caspofungin. For systemic, fluconazole, caspofungin, amphotericin B. (15) Carcinoid syndrome. Octreotide. 16. Chlamydia trachomatis. Doxycycline, add ceftriaxone for gonorrhea co-infection, and oral erythromycin to treat chlamydial conjunctivitis in infants. (17) Chronic gout. Xanthine oxidase inhibitors, allopurinol and febuxostat, pegloticase, and probenecid. 18. Chronic hepatitis B or C. Interferon alpha for hepatitis B and hepatitis C, ribavirin, cimeprevir, sofosbuvir for hepatitis C. 19. Chronic myelogenous leukemia, CML. Imatinib. 20. Clostridium botulinum. Antitoxin. 21. Clostridium difficile. Oral metronidazole, if refractory, oral vancomycin. 22. Clostridium tetani. Antitoxin. 23. Cytomegalovirus. Ganciclovir, foscarnet, cidofovir. 24. Crohn's disease. Corticosteroids, infliximab, azathioprine. 25. Cryptococcus neoformans. Induction with amphotericin B and flucytosine. Maintenance with fluconazole in AIDS patients. 26. Cyclophosphamide-induced hemorrhagic cystitis. Mesna. 27. Depression. SSRIs first line. 28. Diabetes insipidus central. Desmopressin. Diabetes insipidus nephrogenic. Hydrochlorothiazide, indomethacin, amiloride. 30. Hypercholesterolemia. Statin first line. 31. Hypertriglyceridemia. Fibrate. 32. Immediate anticoagulation. Heparin. 33. Infertility. Leuprolide, GnRH pulsatile, clomiphene. 34. Influenza. Oseltamivir, zanamivir. 35. Kawasaki disease. IVIG and aspirin. 36. Legionella pneumophila. Macrolides, such as azithromycin. 37. Long-term anticoagulation. Warfarin, dabigatran, rivaroxaban, apixaban. 38. Malaria. For bloodshazant, chloroquine, mefloquine, adaviquone proguanil. For liver hypnozoite, primaquine. 39. Malignant hyperthermia. Dantrolene. 40. Medical abortion. Mifepristone. 41. Migraine. Abortive therapies, sumatriptan, NSAIDs. Prophylaxis, propranolol, topiramate, calcium channel blockers, and amitriptyline. 42. Multiple sclerosis. Disease-modifying therapies, beta interferon, natalizumab. For acute flares, use IV steroids. 43. Mycobacterium tuberculosis. Rifampin, isoniazid, pyrazinamide, ethambutol. 44. Neisseria gonorrhea. Ceftriaxone, add doxycycline to cover likely concurrent chlamydia trachomatis. 45. Neisseria meningitidis. Penicillin, ceftriaxone, rifampin prophylaxis. 46. Neural tube defect prevention. Prenatal folic acid. 47. Osteomalacia and rickets. Vitamin D supplementation. 48. Osteoporosis. Calcium vitamin D supplementation prophylaxis to treat bisphosphonates, parathyroid hormone analogs, selective estrogen receptor modulators, calcitonin, and denosumab. 49. Sickle cell disease. Hydroxyurea, producing fetal hemoglobin. 50. Sporothrix shanki. 51. Itraconazole, oral potassium iodide. 51. Stable angina. 'Sublingual nitroglycerin. 52. Staphylococcus aureus, methicillin sensitive. 'Nafcillin, oxacillin, dicloxacillin, anti-staphylococcal penicillins. 'Staphylococcus aureus, methicillin resistant. 'Vancomycin, daptomycin, linezolid, ceftaroline. 54. Streptococcus bovis. 'Penicillin prophylaxis, evaluation for colon cancer if linked to endocarditis. 55. Streptococcus pneumonia. 'Systemic infection or pneumonia, treat with penicillin cephalosporin. 'Meningitis, treat with vancomycin. 56. Streptococcus pyogenes. 'Penicillin prophylaxis. 57. Temporal arteritis. 'High-dose steroids. 58. Tonic-clonic seizures. 'Levetiracetam, phenytoin, valproate, carbamazepine. 59. Toxoplasma gondii. 'Sulfadiazine and pyrimethamine. 60. Treponema pallidum. 'Penicillin G. 61. Trichomonas vaginalis. 'Metronidazole, patient and partner. 62. Trigeminal neuralgia, tic douloureux. 'Carbamazepine. 63. Ulcerative colitis. 5 ASA preparations, such as mesalamine. 6 mercaptopurine, infliximab, colectomy. 64. UTI prophylaxis. 'Trimethoprim, sulfamethoxazole. 65. Warfarin reversal. 'Fresh frozen plasma for acute, vitamin K for non-acute. 66. Ethylene glycol or methanol intoxication, Fomepizole, alcohol dehydrogenase inhibitor. 67. Haemophilus influenza B. For mucosal infections, amoxicillin with clavulanate. Meningitis, ceftriaxone. For prophylaxis, rifampin. 68. Pseudomonas aeruginosa. Piperacillin tazobactam. Aminoglycosides, carbapenems. 69. Pneumocystis jirovecii. Trimethoprim sulfamethoxazole. Prophylaxis and treatment in immunosuppressed patients. CD4 count below 200. 70. Enterococcine. Vancomycin, aminopenicillins, cephalosporins. 71. Rickettsia rickettsii. Doxycycline, chloramphenicol. 72. Patent ductus arteriosus. Patent ductus arteriosus. Close with indomethacin, keep open with prostaglandin E analogs. 73. Granulomatosis with polyangiitis, Wegener. 'Cyclophosphamide, corticosteroids. 74. Prolactinoma. 'Cabergoline Bromocriptine, dopamine agonists. 75. Pheochromocytoma. 'Alpha antagonists, such as phenoxybenzamine. 76. SIADH. Fluid restriction, IV hypertonic saline, conivaptan, tolvaptan, and demeclocycline. 77. Diabetic ketoacidosis. 'Fluids, insulin, potassium. 78. Diabetes mellitus type 1. 'Dietary intervention, low carbohydrate, and replacement insulin. 79. Diabetes mellitus type 2. 'Dietary intervention, oral hypoglycemic, insulin if refractory. 80. Drug of choice for anticoagulation in pregnancy or renal failure. Low molecular weight heparin. 81. Heparin reversal. Protamine sulfate. 82. HER2/neu positive breast cancer. Trastuzumab. 83. ER positive breast cancer. Tamoxifen. 84. Generalized anxiety disorder. SSRIs, SNRIs, first line. Buspirone, second line. 85. Schizophrenia positive symptoms. Typical and atypical antipsychotics. Schizophrenia negative symptoms. Atypical antipsychotics. 87. Hyperaldosteronism. Spironolactone. 88. Prostate adenocarcinoma, uterine fibroids. Leuprolide, GnRH continuous. 89. Prostate adenocarcinoma. Flutamide. 90. Erectile dysfunction. Sildenafil, tadalafil, vardenafil. 91. Pulmonary arterial hypertension, idiopathic. Sildenafil, bosentan, epoprostenol.